I'm live. You need to.
Okay.
Don't forget to log on, please, and support. Yes. A little bit of technology issues. So I had my trusty tech partner come to look at things. Oh dear, where are we now? Great. Let's just get things ready. Make sure I have all my slides up properly. Give myself a glass of water. I hope I'm not going to do too much talking, but this is such a packed session, so I'm just sending its chat back to hello, Unique Space. Nice to see you. Thank you for joining. We're doing some behind the scene moves here. Hi, Mark. Thank you so much for joining. Good to see you on here. Just give us a few minutes, just 2 more minutes, and then we shall begin right on time. Mute my phone. Yeah, good. Okay, make sure I have all the information on here. Okay, fantastic. We are live. Thank you so much for joining me. Just a few technical hiccups. I managed to connect the live stream using the wrong link. So I just realized that about 25 minutes ago, and I started frantically creating a new live stream and sending out links. So thank you so much. Hi there. Oh, Philomena, so nice to see you. Welcome. Thank you so much, guys, for joining. So I'm going to make this, I don't want to keep us too long. Sunday afternoon for many of us is a day to rest, but I just like this time, use this time to try and share some thoughts, and I will not keep us too long, I promise. So welcome to AskAwayHealth Live. I'm your hostess, Dr. Sylvia. As many of you know me, a general practitioner and health educator with AskAwayHealth. But if this is the first time that you're coming across me, I'm pleased to have you here. On our channel, we discuss everything medical. Okay, you can find us on social media on AskAwayHealth, and our website is askawayhealth.org. And of course, in our YouTube channel here, and I'll put all the links to our Twitter, Instagram, Facebook, LinkedIn, everything, put them in the description box. So make sure you have at least 1 or 2 ways to connect with us. And look forward to seeing you in any one of those media. Today, we're reflecting on the issue of COVID-19 vaccine side effects. If you watch any of my recent videos, I've talked a lot about the vaccines and what the vaccines are like, the differences between them. And as you know, you have lots of different countries that have taken their orders of 3 main vaccines. And I'm just limiting my discussion to the 3 main vaccines by Pfizer, BioNTech, Moderna, and Oxford AstraZeneca. I intend to, but I haven't done much research on the Russia Sputnik 5 and then the Chinese, China-based vaccine, or the one originated in China, but I'm interested in doing those ones. So hopefully in 1 or 2 videos, I will look at them, do some analysis on them as well. So many countries have started using these vaccines from Pfizer, Moderna, and AstraZeneca. And so my discussion today is sort of limited to what we're finding and what people are experiencing as they use these vaccines. Now, as with any medicine, one of the most important aspects of their use is side effects. And we're probably all familiar with what side effects are. It's always important if you're taking any treatment to know what are the side effects and what should you expect when you're taking them. Welcome, Helen from New and Plata. Lovely to have you on board. Thank you so much for joining in. So let's set the stage first. Side effects are simply defined as an unwanted effect from taking any medicine or using any treatment. Now, they can range from being pretty mild, and a lot of us might have experienced side effects with things like penicillin, which is quite common, ampicillin, amoxicillin, and different things. You can also have side effects or from using vaccines, so not just tablets or other medicines that we use. Vaccines comes into play as well. So they can be quite mild, but they can also be severe and in some cases can cause death. Developing a side effect does depend on both the nature of the drug or the medicine and what's contained in it, and also the individual. So which is why you find that some people may have side effects while to a particular medicine and others don't. So it's not as simple as saying, okay, everybody's going to get side effect to this particular drug and that's it. Some people may, some people may not. What the manufacturers in developing a drug look at during the trials, one of the things they look at is how frequently is a particular undesirable effect happening, and then that determines what kind of safety risk or assessment you're going to place on that drug. So if you have 50 or 60% of your trial, if even less, getting a particular effect, that gives you a warning sign that that is probably not a drug that will be safe for general use. So that's a little bit about setting the stage. Now that we understand side effect is part and parcel of most drugs, the issue is not does it have a side effect or not. The issue is how can we manage the risk of this unwanted or undesirable effect, given that you need the beneficial effect of the treatment. So for example, if I have some kind of infection that is susceptible to penicillin, I need the benefit of treatment, of the cure from this medicine. Or what if I'm allergic to it? Or what if I cannot tolerate it because of some undesirable effect? So it's looking at the risks versus benefit. Of course, for drugs like penicillin, you have alternative antibiotics. So people who have really bad side effects can have alternative antibiotics. So what I'm trying to say is that when we're talking about the side effects, particularly as it pertains to COVID-19 vaccines, think of the risks that we take when we fly or even travel by road or by sea. And it's sad, but a very recent example is the flights from Indonesia that just happened yesterday, where we don't know why. It's still being investigated as to what happened. But then as people step on the flight, yes, your mind is not going to, the plane is going to crash, but that is a risk that one must consider in air travel. What has happened though is, as much as possible, using technology, using all manner of safety precautions, that risk is minimized to the absolute minimum so that it's less likely and we feel confident about flying. We don't just say, oh, we're never going to fly again. We look at what's happened, it's investigated, and we try to mitigate as much as possible any risks. So that is one way of looking at side effects and their occurrence in with medicines, comparing it to other aspects of life where there are sort of significant risks as well. So feel free to ask any questions. I know I have a lot prepared I want to talk about, but if there's anything that jumps out at you or if there's something you want to clarify, please put it on the chat for me to have a look at. With COVID-19 vaccines, the three that I want to talk about, there are a different range of side effects. The more common side effects, which most people will experience, they're generally not life-threatening. They can be uncomfortable or a bit distressing to different degrees. So if you look at the Pfizer and Moderna, what you might expect is after the injection has been given, there might be a little bit of pain or swelling or redness around the arm where the injection has been given. And some people might go ahead to develop feverish feelings, a high temperature, or develop chills and rigors, tiredness, headaches. These are the more common side effects that we expect with these vaccines. And they're common with other types of vaccines, these kind of reactions. They might feel like you're getting in within a couple of days or a week of getting the vaccine, but they will usually disappear after a few days. Very similar is the Oxford vaccine. You might experience the same pain, redness, itching, swelling, bruising where the injection is given. It's actually said that these symptoms or these effects can affect more than 1 in 10 people. So if you have a room of 10 people who have just had the vaccine, more than one of them will end up with some of these side effects. They are that common. Other less common effects that might develop after having the vaccine are things like a lump at the injection site. All of us who've had injections, I'm sure you know that if you touch the area for a few days afterward, there's sort of a small swelling, hard, firm swelling underneath your skin. And again, fever. Some people might vomit. Some people, again, might have a high temperature, might even develop sore throat, runny nose, and so on. Those are the sort of common side effects associated with the Oxford vaccine. Less commonly, or least common, might be feeling very dizzy or lightheaded, loss of appetite, pain in your tummy, large lymph nodes, those glands underneath your chin and in other parts of your body, they might get bigger. Because what's happening, of course, is when the vaccine is given, it's priming the immune system, so creating an immune response so that the body learns how to deal with the real virus anytime it's exposed. So some people have these effects, some people don't, but these are what we expect. It's not something that should alarm us if they happen in the context of having had the vaccine. Right, so I'm not really discussing those today. I just wanted to put that out there for us as sort of the baseline. When you get the vaccine, you may get those reactions, you may not. They will settle usually within a week, 10 days, they will settle down altogether and you're back to normal. But the ones that interest me in this discussion, because sometimes hearing about them outside of context might contribute to being hesitant to take the vaccine or vaccine hesitancy. My intention is not to tell anybody, go ahead, take the vaccine or don't take the vaccine. No. My intention is that a lot of information out there may be flawed, may not be accurate. And some people go ahead and absorb this information, not necessarily because it's the right information, but because that's what they have access to. So I would like an opportunity to help us challenge that information. If it's not right, challenge it. Maybe there's something else out there that's actually correct and not just accept it as face value. Hello, Dr. Franca. Nice to have you on board. Welcome to the live stream. Really glad you could join me this afternoon. And please, guys, if you find this helpful, please like this video. You can just click the like button while you're watching. That just helps, with my engagement, helps to do this. I enjoy doing this. I enjoy putting this material together. It's what I do really on a daily basis. But I would love, for what we're doing to become bigger, for people to have a lot more people to benefit from it. So I would love it as well, so that YouTube helps to push it up on their wonderful algorithm. So I want to talk about some of the reported severe side effects. Now that the vaccine is being used with millions and millions of people that are getting the vaccine, we're now getting more reports, different from some reports we had of side effects or adverse effects during trial. We received some notice of some serious effects during the trials, but now it's going out into live populations and people are reporting things. So I want to look at 3 or 4 of them today, hopefully within the time that we have. I'm going to be very quick now. I want to look at anaphylaxis, and you may have heard these terms before. Anaphylaxis associated with COVID-19 vaccine, Bell's palsy associated with COVID-19 vaccine, a condition called thrombocytopenia, and reports of death linked with COVID-19 vaccine use. So I'd like to look at them and see what's the truth, what's really going on there. I'm going to start with, anaphylaxis. I don't know why my screen went to Bell's palsy. I really want to start with anaphylaxis. Yeah. So anaphylaxis, you might have heard of it. Basically, it's a very severe allergic reaction. A very severe allergic reaction, potentially life-threatening. It's a very serious medical condition. And I think it's one of the most common severe side effects associated with these vaccines so far. There are some other things, I might just touch on them if I have time. But anaphylaxis is one of those that has really, that the numbers compared to the 1 or 2 in other cases. So anaphylaxis is just getting attention. And please remember that although the vaccine trials have concluded, but studies are still being made in every country. They're still going on. There's a reporting system. So in the UK, for example, if somebody develops a bad reaction to the vaccine, you're supposed to send in a report to the UK Regulatory Agency for Medicines and Healthcare Products via what we call a yellow card. And the same in the United States, and I'm sure in other countries of the world. So it's not that the manufacturers have created the vaccine and they're off making all the money and all that. No, they're still studying the effects of this vaccine while it's going out into non-trial members of the population. So anaphylaxis is a potentially life-threatening condition. It could be caused by anything, not just medicines. You've heard of people who have severe allergy to things like peanuts or some type of nuts, or shellfish, or eggs, and hair dye. So if, for example, they come into contact with this thing, or suddenly they collapse, they stop breathing properly, their face starts getting swollen, and it happens very, very fast. So this is anaphylaxis that we're talking about. Now, can we predict who will get a severe allergic reaction? Not always. If somebody has had it before, if somebody has used hair dye and they've had a really bad reaction before, then you know your red flag antenna goes up that this person may have an issue next time. Particularly, they shouldn't have their hair dye again. Particularly, they shouldn't be eating anything containing peanuts. And such people are the ones that must always carry an adrenaline injection, or what we call the EpiPen. So you have those groups of people out there in the community who have had serious reactions with injections. There's one injection that I can't remember the name, but there's some people that get some injections, whether it's injection for treating an infection or for whatever, and they develop a reaction immediately. Within less than 15 minutes, less than 30 minutes, the reaction starts. So it's life-threatening. It needs urgent attention. In terms of anaphylaxis and the COVID-19 vaccine, we have had cases reported in both the United States and Britain, and we shouldn't be surprised if it comes up in other countries. Most of the cases, most of them, follow the use of the Pfizer and Moderna vaccine, okay? More common so far, more common with Pfizer, and the authorities, like I said, they're still keeping a very close eye to figure out whether is this thing just related to Pfizer and why. So there was a study released by the US CDC, and what they've determined is that while there have been some numbers of people who develop this reaction, the numbers are still very low, okay? Now, the risk so far that they've observed is a little bit higher of getting anaphylaxis, is a little bit higher with the Pfizer vaccine compared to, let's say, the flu vaccine, okay? The risk is slightly higher, but even at that, it is still a very small risk. So not all of us who get these vaccines are going to get anaphylaxis. The people who are more likely to get it are those who may have had a severe allergic reaction to something in the past. And so the advice from the regulatory authorities is, if you've had a severe allergic reaction to a vaccine in the past, then you shouldn't be having this, or you should speak to your healthcare practitioner so that it's very clear what you need to be doing. And so that's generally what they're told. These are the people that we're quite sure are likely to develop an allergic reaction simply because they've had one in the past. The other thing to note that's interesting, and of course is still being studied, is the people taking the Oxford AstraZeneca vaccine. So far, there haven't been reports of anaphylaxis. So, like I said, it's the overreaction of the body's immune system. Okay, it's severe, it's life-threatening. The symptoms develop very, very fast. And in some cases, like I said, within less than 15, 30 minutes, there's difficulty breathing. They might feel very faint or even collapse. And you might notice that the eyes get swollen, the tongue gets swollen, tissues inside the throat and the neck get swollen, making it difficult to breathe. Now, obviously, such a thing happening is very scary. That's why initially the advice was for people having the Pfizer vaccine, they need to stay around for about 15 minutes so that we check that there's nothing going on, that they don't develop any of these untoward reactions. But really, that's where we are. So far, it's been more with the Pfizer vaccine. It is real. There is some number of people developing the reaction. It's a very small number of people. It's most likely in people who have had a reaction before. And in fact, the cases reported are about 21 associated with the Pfizer vaccine so far. Now, 17 of those people already had allergies. So I'm reading from a report that's been prepared on anaphylaxis in people using the Pfizer vaccine. 17 out of the 21 reported already have had a history of an allergic reaction to food, medicine, other vaccines, even bee sting. So these are the people who really shouldn't be getting the vaccine. We can already predict that this might happen. Okay, so I want to move forward now because I want to talk about the other possible severe side effect. And again, welcome. Let me just check in with the chat and not just keep chatting away. So welcome. Oh, welcome, Clara. Thank you so much. Hey, Doc, enjoying this learning. Well done. Thank you so much. Hi, David. Hi, David. And hello, everyone. Hello from Refreshing Insights. Thank you so much. Glad to have you guys here. Really appreciate it. Don't forget to like the video. And yeah, absolutely. David says vasovagal reaction. Absolutely. You know, that can happen in somebody who is having an anaphylactic reaction. So let's move away from that briefly. Before I forget, I also want to touch on reports of death with COVID-19 vaccine. And simply because I've come across some WhatsApp groups where videos are circulating where people are saying, oh, the vaccine kills people. Now, so far, and if you have a report, please let me know so I can go and check it out myself. So far, there is no report that anybody has died directly because that is outside of the trials, that anybody has died directly as soon as they had the vaccine. I'm going to share one case with you, though, where an individual did die 3 weeks-ish after he had the vaccine, and it's been investigated. I will share that with you. But in terms of getting the vaccine and then the next day or within the next few hours, the person died, after the trials, there's no report. But let's talk about the trials, during the trials, and this is for Pfizer now. There are stories that went around that said that 6 people died during the Pfizer vaccine trials, during the last phase 3, the biggest trial where you're looking at safety, effectiveness, you're giving it to a wide group of people of different ages and different health backgrounds, different geographical areas, just to see if you can get a similar effectiveness and safety profile. Now, that claim that 6 people died is a bit misleading, and let me explain why. According to the report from Pfizer, and it's open, so this information is out there. They have to submit these reports. So according to a report that is on the CDC website, and it's also in the FDA website. I think I got that from. And I will put the links. I have lots of references as usual. So if you're interested in going to check it out for yourself, please feel free. I'll put all the links in the description once I finish with this live stream or later on in the day. Anyway, the claims are partly false, because what happened is 6 people did die during the Pfizer trial, but only 2 of them were given the vaccine. Remember that in a trial, you're going to have a vaccine group and a control group. So a group, people, and they're blinded, when you have these random trials. So nobody knows what they're getting. You're just going to get an injection. They will not tell you whether you're getting the vaccine or whether you're just getting a plain saline or some other solution that's harmless. Because what they want to do is, and even the person giving you the injection would not know, just to make sure that whatever effect is not influenced by anything but the effect of the medicine. But anyway, I'm digressing. So the people who did not get the vaccine, out of this group of 6 that were reported in the trial, 4 of them were given a safe solution of salt and water. When they investigated the cause, what happened, what was the cause of death for these people, the investigators determined that it was something that could have happened to these individuals and was not related to the vaccine. So 2 people did die. Both of them were in the older age group, because they used people who were young and the group of people who were old. Different age groups were part of the trials. The 2 people who died were in the older vaccine group, and it was related to heart problems, related to heart disease. And again, like I said, the links will be in the description for you to have a look at. The other 4 individuals who died, 2 of them were in the younger group, 2 of them were in the older group. They still, even as of the time I checked this literature, which is printed or published November, December, still looking at the cause of death, it certainly was nothing to do with the vaccine, because they didn't receive the vaccine. So I wanted to clarify that about reports of death. Again, like I said, I have not heard of any reports of death in people receiving this vaccine since the trials, sort of having the vaccine and a couple of days later they passed on. I've not heard of that. But I do want to bring you to this case I came across a couple of days ago. And I mentioned thrombocytopenia. Thrombocytopenia is not a condition that's new in medical science. It's a technical word, but all it means is that there is very low levels of your blood platelets. The 3 most common blood cell types that we have are your red blood cells. Lack of red blood cells means you have anemia. Then your white blood cells, lack of white cells might contribute to developing an infection, and your white cells are also involved in your immune system. And the other group is the platelets. They're very important in clotting, blood clotting, along with other network within the body. They're involved in blood clotting. So let me tell you the story that brings this up, and this is quite recent. So this is a healthy obstetrician who died 16 days after he received the Pfizer vaccine. It is still being investigated as we speak. Now, this was a previously healthy individual. Apparently, he received his first dose of the vaccine on the 18th of December. And 3 days later, he developed very dark spots on his legs. And developing very dark spots suddenly on the legs that look like bruises, they don't disappear, and feeling unwell, he was taken to hospital. At the hospital, it was determined that his platelet count was zero. Normally, platelet counts for healthy adults is between 150,000 to 450,000 per microliter of blood, but his was 0. That means that if you cut him, if he had a scratch or a cut, his blood would not clot, it just flows. Of course, you can imagine the impact of that. So this gentleman was admitted, and the diagnosis when he was admitted was this thrombocytopenia caused by a reaction to the COVID vaccine. Despite the treatment in hospital, eventually he passed away on the 4th of January, 16, 17 days afterward from a hemorrhagic stroke. This is the only one case so far that you might question, was it the vaccine that caused this to happen? Now, this is being investigated not just by Pfizer, but obviously by the US FDA and other authorities. Because thrombocytopenia can also happen in many other conditions. In very rare cases, thrombocytopenia has happened with people taking the MMR, the measles, mumps, and rubella vaccine. So it has happened before. The same condition happens in people with cancer. Cancer, very, very heavy drinking, some types of viral infections, even some drugs that we use to treat high blood pressure, like some diuretics, can contribute to thrombocytopenia. So what I'm trying to say is, let's be aware, this is just one case, and this vaccine has been administered to millions of people. This is one rare case. It's still being investigated. So if somebody says to you, I heard the vaccine kills, I don't want to lie to you. This is what we're looking at. This is the evidence, but this is just one case from what we've seen so far. So that's about thrombocytopenia. Let me just quickly check the chat and just make sure if you guys have any question. Okay, no questions so far. That's fine. So I don't want to make this go any longer than this, but I had so much to say. Okay, the next severe side effect, I'm sure you might have heard of this, is Bell's palsy. Let me quickly touch Bell's palsy. So Bell's palsy, during the trial, they reported some incidents of Bell's palsy. Bell's palsy is a nerve-related problem. It's when a person suddenly develops weakness on one side of the face. That part of the face just suddenly. A good example is the person just wakes up in the morning and goes to brush their teeth, and there is something wrong because they can't close their mouth properly or they can't close their eye properly. So Bell's palsy is a neurological problem. The muscles and some of the other structures on one side of the face are affected. It could cause stiffness or numbness. They can't close the eye properly. The eyelid is drooping, or they can't open the eye properly because the muscle is weak. And it can also affect the taste and the sense of hearing. Bell's palsy happens outside of COVID-19 disease. It's sort of a fairly common medical condition. I forgot to check the frequency. I'm sorry, I just didn't think about that, but I don't know it offhand. But obviously, I can always look it up and let you know. But it happens outside of COVID-19. We don't know exactly what causes Bell's palsy, but it's not a stroke, okay? And in Bell's palsy, the area underneath the head is not affected. So what we think is that it may be linked with a recent viral illness. So somebody has had a brief cold or a brief ear infection. You don't even think about it. You just feel a bit odd for a couple of days and completely forget. And then 2 weeks later, suddenly, Bell's palsy. So we're not sure. We think it might be linked with a recent viral illness or some other stress. But what it does, whatever that event is, what it does is that it affects the big facial nerve, one of the big nerves that comes out from our brain that supplies our face muscles. So it affects that nerve, and it's temporary, it's treatable, it's reversible. Generally, after a couple of weeks, if you don't treat it, it goes. But when we identify it, we treat it quite successfully with steroids. So that's what Bell's palsy is. There's no brain damage. Literally, the injury to the facial nerve recovers after a couple of weeks. It's improved with steroids. I'm not saying it's not a significant medical problem. Of course it is, but I'm saying that it can be treated. But what is of interest here is they said that during the trial, some people developed Bell's palsy. And according to the document published by the FDA for Pfizer and Moderna, 8 out of 74,000 did develop Bell's palsy in the trial group. So you might hear somebody say, I heard that this vaccine causes nerve problem and nerve damage, and you want to ask them exactly what do they mean, because it might be this Bell's palsy they're talking about. It happened during the trial. So far, we've not heard reports of it happening after, and this is something that we're still looking for. Now, the conclusion from the US FDA, Food and Drug Administration, was that they don't think this Bell's palsy that happened to those people was caused by the vaccine. Okay, you may or may not believe it, but this was their conclusion. And they said it's because the frequency or the occurrence of Bell's palsy in that population of people is exactly the same as it will happen in the normal population, those who are not receiving any vaccine. So there isn't any big concern that Bell's palsy can happen simply because you've had the COVID vaccine. And actually, the advice on the CDC website is that somebody who has previously had Bell's palsy can receive the Pfizer vaccine. So let me quickly steamroll on and just come to a point of conclusion, because what I wanted to share was the thinking around some of these serious problems. I think it's just good to look at, if you're thinking about side effects and how it might affect you. We've talked about the more common side effects. So that is, it could happen. You might be one of those lucky people, they give you the jab and you don't feel anything, and that's it. Or you might be one of those people that gets the fever or the chills and so on and so forth, which we say are common, and they settle down fairly quickly. Within a week or so, you're back to normal. But when we're thinking about those serious effects like death, anaphylaxis, thrombocytopenia, and Bell's palsy, and things like hemolytic anemia. Oh, there's another one, transverse myelitis. It's good to look at the literature to see what are the numbers. Were they really due to the vaccine, or were they events that might have happened anyway? And are they happening more frequently in the people taking the vaccine compared to if they were not taking the vaccine? Those are the questions to ask. So I thought it was interesting to have a look at these vaccines and say, okay, so what exactly is causing these reactions? And what I found out was that for the Pfizer and Moderna, both of them are mRNA-based vaccines. And if you don't know what those are, please go back into my channel, have a look. I've really talked about the differences between the vaccines. But Pfizer and Moderna vaccines, they don't contain the virus. They don't contain the virus. They're gene-based vaccines. They contain man-made messenger RNA, which just puts the genetic code into the body cell. And the body uses that genetic code to create the protein, to artificially create the protein, the spike protein in our bodies. So it's not the virus that's going into your system. And when it does that, the body's immune system sees that protein, that's an enemy, and then develops a response. And that response, the body learns it. It has memory of that response, and then everything settles down. But in future, if you're exposed to the virus, once the spike protein comes near you, the body says, we know what that is, we've seen it before, and then it mounts a response and kills it. That's the general basis of the vaccine. But these vaccines don't contain egg, they don't contain yeast, they don't have virus, they have this mRNA, but they do have a chemical compound called polyethylene glycol. And the people who study this thing, the scientists say, it's possible that is what may be causing the problem, the reaction. But this polyethylene glycol is something that's been around for ages. In fact, they use it to make our creams, our soaps, cosmetics, and personal care products. So, who knows? So that's for Moderna and Pfizer. And you have something similar. That one's called, let's see the name of that one. And you have something similar inside the Oxford AstraZeneca vaccine. So the Oxford AstraZeneca vaccine, though it doesn't have messenger RNA, it's a viral vector. So what's actually in the solution is a weakened virus, a weakened chimpanzee virus, carrying the code that helps the body to create the S protein again. So that's what's introduced, but it's weakened, so it's not going to cause ill health. However, the vaccines or the solutions will be developed inside solutions containing things like alcohol. Polysorbate is something that's similar to the PEG. That may be something responsible for any adverse effects. But so far, no anaphylactic reactions with the AstraZeneca vaccine. So, my friends, in conclusion, 30 minutes of pulling your ears with all manner of biology and technology, but I'm really glad that you're listening. So the conclusion is this. We have to combat misinformation with hopefully the right information. That we're still studying the vaccines. Responsible organizations have systems in place whereby any adverse effect that develops is quickly reviewed so that is this a safety profile, particularly, and there's genuine concern from people who say, well, what about long-term effects? That's genuine, and that's a reasonable question to ask. And that is why responsible countries, organizations will have long-term monitoring systems. I think the question that we have to ask is, well, why didn't we wait 4 or 5 years to check out these side effects before we started using this product? And then you have to weigh that against, but you have something that is effective and doesn't show significant bad effects in the short to medium term, versus you have people dying because of the virus. So those are sort of the questions that one has to ask. But I found it interesting to really have a look at these reported severe side effects and see how they could be relevant. So any questions, guys, make sure to, feel free to ask, put a comment if you like. I'd really appreciate it. Hey, Yawande, thank you so much. Thank you so much for joining. Welcome. And again, if you want to subscribe to our channel, please subscribe, click the button if you've not done so already. Like the video, leave a comment, share the video. I would actually appreciate if somebody came up and said, well, actually, I heard this or I heard that, because that gives us an opportunity to discuss and interrogate the facts. And then all of us come out the better, because of course, I don't want an adverse effect if I can avoid it, and I don't want that for any of us. So that is my thought for the Sunday. So thank you so much again for joining AskAwayHealth Live. We're going to close this stream in a couple of seconds. Thank you so much, guys, for joining. Yawande, thank you, Ola from Unique Space, Refreshing Insights. Thanks, David, Clara. Mark, thank you so very much, guys. I hope to see you again in the next stream, which will usually be on Sunday around this time. And I will send links out for the topic in a few days before. Take care. Bye.